Hi, this video is the art of hair transplant restoration surgery on a Caucasian man who flew all the way from New Zealand to California. So it's a good 12-13 hour flight for me to restore his hairline. And you know, hairline, as I know, as the audience realize, that it is the one of the type of surgery require quite a bit of the artistry and the artistic and aesthetic details. And for me, focus heavily on the hairline, and this is all I do. I don't, you know, I don't do other type of cosmetic surgery, breast or liposuction. The only thing I do is hair transplant, specialized hair transplant. But I focus heavily on the artistry because you don't want to do the hairline so high where it looks abnormal. You know, some people do the hairline all the way up here and high, or you don't want to do too low too. The way I create the hairline is like a custom hairline. It's very unique for each individual facial structure. I built the hairline around your facial structure, so the hairline that you will have is different from your brother, your father, and pretty much anybody else. In general, rules of thumb for Caucasian from the mid-eyebrow to the hairline, average is around 7.5 to 8.5 centimeter. For this client, his is 7.25. So, you know, not everybody gonna fit exactly within the bell curve, 7.5 to 8.5. Sometimes a little bit 7.25. As long as from the mid-eyebrow to the hairline is a third, from the mid-labella to tip of the nose a third, tip of the nose, bottom chin's a third. Once you have the proportional and the symmetry and the lower hairline, and it brings out the eyes, the nose, and all the features that God created. He is already a handsome guy, but when you frame the hairline, frame the face, I mean lower hairline which frame the face, it really bring out his handsome look, the eyes, the nose, and all the features that God created. So once we get the height down, and again, the more narrow face, the more arched back the hairline is, the more round the face, the more flat the hairline is. And then no hairline straight, so we zigzag too. Now, there are two types of hairline. They call it the soft hairline and the tight hairline. So for the guys who like sharp hairline, we have a smaller zigzag. For the guy who like very soft and natural look, and then we have a bigger zigzag. You know, it's just very individual. So you know, I can pretty much cater for that, or you can go somewhere in between. Once we get the shape down, we will transplant a very precise angle at 35, 45 in the front, increases when you go backward, and changes when you go different direction. Not only the precise angle is important, selection of hair graft is important. We try and plant rows and rows of single hair graft in the front, followed by root of 2 hair, 3 hair, 4 hair in the back for bulk and volume. So the angle of hair is important, the type of hair is important. And so if you turn this way, you can see it's gone back quite a bit, all the way here, and all the way here. And again, the no hairline straight is so it's slightly arched up and nice zigzag, and it blend in. It's not like an abrupt triangle sharp edge. So we tend to blend it in so it looks very natural that way. So this is the art of hair transplant restoration surgery on a Caucasian New Zealand man who flew all the way half around the world for me to restore his hairline. So hopefully if he can come back, then we can see a fantastic look, a different look for him. Thank you.